Good morning friends, once again welcome to Pharma Skills. Before going to the session, if you are finding my videos are very useful to you, I request you to please like, share, comment and subscribe. Before this we have done two videos regarding the basics and fundamentals of pharmaceutical. If you have not seen that, it has been added into description link, you can go through the videos. Today I have come up with very interesting topics, that is one is consistency, second is absorption, and third is adapting to the situation. When it comes to consistency, I can give you a lot of examples. When we in India we watch a lot of cricket. It is when we say it is a god of cricket, such is Sachin Tendulkar. His consistency of 20 years has given this name. Second is Virat Kohli, where he is known as one of the best cricketer in the world because of his consistent performance in all forms, either it is Test or One Day or T20. There is a saying: if a small drop of water keep on falling on the stone, at some point of time the stone will also have dented itself. So consistency means doing the same thing, improving ourselves and implementing new strategies and proving ourselves and growing within ourselves to newer heights. Consistency is very important in our profession, my dear friends. When it comes to consistency, I like to tell consistency in our field is visit pattern, clinical performance, putting ourselves, projecting ourselves in front of doctor. Now it has become a trend that visit patterns become a very difficult, and maintaining that and meeting those doctors has become a very difficult. For example, in most of the company, we have 100 doctors or 150 doctors or maximum or 120 doctors. Company says you will be dividing these doctors on their potential as A, B, C. For A doctor you have to meet 3 times, few companies says 2 times, and C doctors 1 time in a month. When it comes to this, consistency is very important. As you know, in pharma market, 80% of the business come from 20% of the doctors. 80% of the business comes from 20% of the doctor. Means you will be getting around 80% of the business from this A-class doctors. Consistency means 1, 11 and 21. If you meet on this on regular basis, this is known as consistency. If chance, if you meet him on 1 and if 11 doctor is not available, if you meet him on 21st, this is not known as consistency. If doctor is not available on 11th, you have to meet him on 12th and once again on 21. This is known as consistency. If this gap is there of 20 days, this is not known as consistency. Friends, this is very important. Consistency in meeting the doctors, updating yourself in whatever the diary or manual given in the organization. It will help you in maintaining this pattern of consistency of equal days. If you fill the diary or manual given by the organization on daily basis, you will come to know how much doctors you have met on regular intervals, how many doctors you have met on frequently, or how many doctors you have missed. If you update the diary on month end, that is 31st or 30th of every month, whoever the doctor has missed, it is missed off for that month. So my sincere request is, when it comes to consistency, it can be measured only through work diaries given by the organization. Update the diary on daily basis, if not on daily basis, once in 3 days, so that you will avoid this missed calls to minimum numbers, and you will also plan this type of avoiding this type of situation where you can you meet doctor after 20 days or 25 days, where this consistency will not also go. So my sincere request is, consistency is meeting doctor on consistent interval. That is consistency. Second is absorption. Observation is very important in this profession. Observation of competitor knowledge. Third important factor today what I want to discuss is adapting to given situation. See, situation is not under our control, but adapting to that situation, turning negative into positive is very important. When I say this, turning negative into positive. A role model is Mr. Rahul Dravid, who is called as a wall of Indian cricketing. When he joined into Indian team, he was out of Indian team for 2 to 3 years because of his strike rate. It was around 21 or 22. Once again, when he was back, he had played from first position to seventh position. He started with seventh, sixth, fifth, fourth, and third. Few matches he had played as an opener also. When India was facing a batsman less, when they took one more batsman extra, Dravid adopted and considered as a wicket keeper. This turning negative into positive is the great example you can take as a role model as a Rahul Dravid, where negative situation, where he was out of the team. Once again he came into team, playing at the seventh level, sixth down, fifth down, fourth down, improving himself and added some to team to perform for Indian team. This is pushing negative into positive. Situations are not under our control, but adapting to the situation is very, very important. Sometimes doctors say negative things, sometimes chemists give some negative things. At that point of time, don't lose your temper or don't lose your hope. Changing that is in our hand. How we take the situation is in our hand. If chemist is saying this product is not moving from past 5 days or whatever the stock you have come from past 1 month, don't take it negatively. Take it as a challenge, and we have to convince the doctor. 90% of the time what we do is we go promote the brand as per the company norms and we will come back. But whatever it is in your head, if you don't communicate, doctor will not come to know what it is you are telling. You have to tell, sir, we have made available as per your instructions around 1 month back. Still no, your stock has not moved. Chemist was telling all the 5 boxes is laying there itself in the rack. So whenever you get a chance, sir, maybe you are unable to remember our brand name. With your permission, I will send an SMS or WhatsApp reminder with your permission. You have to look for different strategies or different way how we can promote the brands. That is very, very important. Considering negative where chemist was telling it was not there and convincing doctor to tell that it is not moving, it is into positive way. The doctor will also take it very serious. This boy is very professional in his approach. He had made it available, now he is reminding and he is requesting for reminder through messages. 90% of the doctors will not deny, they will tell remind through messages or WhatsApp. This is what adapting to the situation. Now in pandemic situation that we are facing, most of the hospitals are and nursing homes, they are not allowing medical representative. This is a situation is not under our control. But how to meet the doctor is under our control. Most of the time I don't say that I am not in a favor to say that you go in casual dress. But sometimes you can go in formal dress without bag, you can carry LB cards or any teasers and go and meet the doctor. This is what I mean adapting to the situation. Today what we have covered is all three is fundamentals and basics. This is not taught by all the company people or what. These are all taught by your experience. Once you go through the experience, you have to keep on remembering and you have to adapt to other doctors. These basics and fundamentals and these three are very, very important. One is consistency. Consistency means it should be met on regular interval. There is a saying by great martial art player, the Mr. Bruce Lee. He says instead of finding 10 new ways, 10,000 new moves, perfect yourself one move and practice 10,000 times, that will be perfect. This is what I mean by consistency. Second, minute observation during field work. That will also add on in clinical performance. Third is adapting to the situation. If situation is not under our hand, we should not keep quiet, we should not blame others. We should adapt the situation and we have to produce the result. End is a result. All the company sees result. This is what we require. Slowly monitoring, consistently meeting the doctors, and adapt in the situation is very very important. As I told in the first video, the same basics. In first video I had shared about dressing skills that helps you in impressing doctor in the first visit. In second, I had told how to meet the doctor, what are all the preparation required before and after meeting the doctor. There we covered RCPA and RDRP. Right doctor, right product. I hope this video you will find it very interesting. Next session we will be taking on brand doctor matrix, where you will be finding different things, different psychological what happens in the doctor's mind when patient is sitting. It will be on this topic, that is doctor brand matrix and psychology of our prescription. Once again, thank you very much for valuable time. If you find this as video as a useful,